In the hospital setting, nursing documentation is a critical component of patient care. It serves as the official record of all assessments, nursing interventions, and the patient's responses to those interventions. Accurate and comprehensive documentation not only facilitates seamless communication among multidisciplinary healthcare teams, but also ensures continuity of care, supports clinical decision-making, and provides legal protection for healthcare providers. At Our Lady of Mount Carmel Medical Center, the Charting Committee operates under the Nursing Service Department and is dedicated to enhancing the quality of nursing documentation. The committee's primary role is to establish, implement, and monitor documentation standards by guiding nursing staff, identifying and correcting deficiencies, and fostering a culture of accountability and continuous improvement. The Charting Committee of Our Lady of Mount Carmel Medical Center is committed to establishing and sustaining a culture of excellence in nursing documentation. Its objective is to ensure that all patient records are accurate, complete, timely, and aligned with professional and legal standards. By implementing standardized procedures, ongoing education, and systematic audits, the committee aims not only to minimize errors, but also to enhance communication, promote patient safety, and support evidence-based clinical decision-making across all nursing units. The Charting Committee of Our Lady of Mount Carmel Medical Center announces the new standardized documentation forms to be accomplished. First, the vital signs sheet, which is designed for special areas requiring intensive monitoring or only vital signs monitoring. Second, the fluid intake and output form, which is used to monitor the patient's intake via IVF and oral or NGT, as well as their output for a 12-hour to 24-hour shift. Third, the graphical vital signs monitoring sheet, a new form in line with DOH requirements, which monitors the patient's vital signs through a graphical method. This form is designed for use by MSU nurses, where the patient requires a basic frequency of vital signs monitoring. Fourth, the neurovital signs sheet, which is used to monitor the patient's neurological status, including their level of consciousness through the Glasgow Coma Scale, pupillary responses, and motor activities. Fifth, the parenteral fluid flow sheet, or IVF sheet, which tracks all IV fluids, side drips, blood products, and TPN that the patient receives during the course of treatment. Sixth, the medication sheet, which records all administered medications, their frequencies, and the medications the patient is currently receiving. 7. The physician order sheet, which serves as a structured guide for healthcare professionals regarding patient treatment and management. And 8. The nurse's progress notes, used by nurses to document their assessments, nursing diagnoses, interventions, actions, and the patient's responses, using the FDR format. Starting off with the first one. Here's how to fill up the vital sheet form. First, start with the personal information section. Write the patient's last name, first name, and middle initial. Then indicate the age and sex of the patient. After that, write the name of the attending physician and the room number. Next, proceed to the vital signs section. Start by writing the date today and your shift. Use black ink for the day shift, which runs from 7 a.m. to 7 p.m. Then, record the time, the patient's blood pressure, pulse rate, respiratory rate, temperature, and oxygen saturation in the spaces provided. Make sure to record these vital signs every hour. Do the same for the night shift. For the night shift, use red ink, which runs from 7 p.m. to 7 a.m. Once you've filled out all the required fields, review the information to ensure everything is accurate and legible. And this is how you fill out the vital sheet form. Then, moving on to how to fill out the fluid intake and output form. First, write the patient's details such as their last name, first name, middle initial, room number, and their attending physician. For the intake section, start by filling out the date. Remember to use black ink for the morning shift. For the IVF column, input the total IV fluid for 12 hours in milliliters. For the oral or NGT column, record the total oral fluid intake or UNGT feeding for 12 hours in milliliters, then add the total. For the output section, start by measuring the total urine output of the patient for 12 hours in milliliters. Next, for the drainage column, there are 4 sections. First section, BM, record how many times the patient had a bowel movement within 12 hours. Second section, drains, indicate if there are any drains present such as JP drains. Third section, CTT, record how many milliliters were drained if the patient has a chest tube. Last section, indicate if there are any other drains aside from the 3 mentioned. After that, write the total. Once all the data has been recorded, write your name, signature, and license number. Do the same for the night shift. Remember to use red ink. For the total part, add the intake recorded from your shift together with the morning duty total. The same applies to the output column. Add the urine total from the morning duty and from your shift. Finally, write your name, signature, and license number after recording. And that is how you fill out the fluid intake and output form. This is how you fill out the graphical vital signs sheet form. First, start with the patient's information. Write their last name, first name, middle initial, age, sex, attending physician, and room number. After filling out the patient's details, proceed to the next section. Begin by writing the month and year, followed by the day of the month. Then, record the patient's weight in kilograms. Next, there are 5 categories that need to be recorded. All of these should be taken every 4 hours for both the morning and night shifts. The first 3 columns must be graphed. These are the respiratory rate, pulse rate, and temperature in Celsius. For the other categories, such as oxygen saturation and blood pressure, simply record the readings in their respective boxes. Let's start with the first column, the respiratory rate. Record the patient's initial respiratory rate by encircling it. This will serve as the base rate. For the graphing part, you'll notice 3 bars. The middle bar means there's no change or the rate remains stable. The upper bar indicates an increase from the base rate, while the lower bar indicates a decrease. Then, every 4 hours, record and plot the succeeding rates. Do the same process for the pulse rate, encircle the base rate, then continue plotting every 4 hours. However, there are cases where the rate you record falls under the categories shown on the right side. For example, if the recorded rate is 80 and it appears on the right column, you may plot it directly there instead of the top bar of 70. Continue recording and plotting as needed. Next, do the same for the temperature. Record, plot, and graph the data accordingly, just like the previous columns. For oxygen saturation and blood pressure, record the readings every 4 hours as well. Finally, repeat the same process for the night shift. Begin by writing the date and recording the patient's weight in kilograms. Plot the temperature, respiratory rate, and pulse rate, and write down the oxygen saturation and blood pressure. Remember to use red ink. And that is how you completely fill out and accomplish the graphical vital signs sheet form accurately. Now, let's proceed with filling out the neurologic vital signs sheet. Begin by filling out the patient's basic information. Input their last name, first name, middle initial, age, sex, attending physician, and room number. Then, input the date and your shift. Take note to use black ink for the morning shift and red ink for the night shift. After that, tick your schedule on the right side of the sheet. Then, proceed to fill out the level of consciousness section below. There are 3 categories: best eye-opening, best verbal response, and best motor response. For best eye-opening, there are 4 levels. Tick the appropriate category and do this every hour. On the right side, tick the corresponding information. For best verbal response, there are 5 levels. Tick the appropriate category and do this every hour as well. Also, indicate whether the patient has an endotracheal tube or tracheostomy tube. Lastly, for best motor response, there are 6 levels. Tick the appropriate category and do this every hour. After completing all categories, get the total score or frequency for each hour. After completing the first category, proceed to the second category, which is checking the pupils. Use the provided graphic as your reference for determining pupil size. Begin by recording the pupil size of the patient's right eye. Indicate the appropriate reaction. Perform this assessment every hour. Repeat the same procedure for the left pupil and record the findings every hour. Then, proceed to the last category, which is motor activity. Record the two subcategories, the patient's arms and legs. For the arms, observe and document the movement of both. Use a check mark for the left arm and a cross mark for the right arm. If both arms fall under the same category, you may simply tick the both box. Then, do the same for the left leg, record and tick the appropriate category. And that concludes the procedure. You have successfully completed the neurologic vital signs sheet. And now, moving on to filling out the parenteral fluids flow sheet. Start by filling out the patient's information. Write the patient's last name, first name, and middle initial. Then indicate their age, sex, attending physician, and room number. Next, proceed to fill out the parenteral fluid section below. Start by writing the date and the number of bottles. Then indicate the type of fluid as prescribed by the doctor. Write the name of the fluid, the amount, and the recommended measurement per time interval. After that, record the time it was started and the estimated time it will finish. For the date changed discontinued section, indicate the date when the fluid was replaced or when it was discontinued. Lastly, under the remarks section, indicate if anything was added to the fluid, such as potassium chloride, vitamins, or other additives. Remember, use black ink when filling out the form during the morning shift and red ink during the night shift. Then, moving on to the bottom part of the sheet. Fill this section out if the patient requires a blood or plasma transfusion, total parenteral nutrition or TPN, or if there's a side drip record to be noted. Similar to the instructions above, write the date, the number of bottles, and the type of fluid to be administered, along with its measurement per interval. Add the time it started and the estimated end time. Then, record the date and time when it was replaced or discontinued. Include any remarks as well, if there are any. Remember, use black ink when filling out the form during the morning shift and red ink during the night shift. And that's how you properly fill out the parenteral fluids flow sheet. Moving on to filling out the medication sheet. First, complete the patient's details. Write their last name, first name, middle initial, room number, and their attending physician. Next, write the list of medicines to be administered to the patient. Make sure to use generic names only. Follow the dosage form route frequency format when writing each medication. Then indicate the time intervals in the columns and write the date today. Remember to use the appropriate ink color. Black is used for the morning shift. Write your initials if you were able to administer the medicine to the patient. If not, supply the appropriate condition. You can use the bottom part of the sheet as your reference. Follow the same procedure for the night shift and continue administering and tracking the medicines given to the patient. After that, at the bottom part of the sheet, write your name and license number under the name of medication nurse column, or you may use a trotted stamp. Then, write your initials in the second column. Use the same format for the night shift. And that's how you fill out the medication sheet. Next, here's how to fill out the physician order sheet. Start with the patient's details. Write their name, ward or unit, and room number. During each patient round, the attending physician records the date and exact time of the visit. The physician then writes their assessment and any additional notes under the progress notes column. After that, they write their orders in the physician's orders column. Once the physician has finished recording their orders, the nurse on duty, or an OD, must countersign to acknowledge the orders. To do this, the nurse should draw a slanting line after the doctor's name, then write their name, license number, signature, and the time and date the orders were carried out. In writing the next entry, maintain 3 blank spaces before starting. And that is how to accomplish the physician order sheet. Moving on, let's discuss how to properly fill out the nurse's progress notes. Accurately fill out the patient's demographic information found at the bottom portion of Sheet 1. This includes their name, ward or unit number, and room number. Then, proceed with writing the report. When writing your progress notes, follow the FDAR format. F stands for focus or the main issue or concern. D stands for data, which refers to the relevant assessment findings. E stands for action, which includes the nursing interventions provided. And lastly, R stands for response, which refers to the patient's reaction or progress. Then, start by writing today's date, followed by the focus, the data and the time it occurred, the action and time it occurred, and the response. Also, remember to use black ink for the morning shift and red ink for the night shift. At the end of each chart entry, include the complete name, license number, and signature of the nurse on duty. And if you need to write another entry, make sure to leave 3 blank lines between each nurse's note to ensure clarity and consistency. After that, make sure to double-check all the data given, and that is how you properly fill out the nurse's progress notes. That sums up how to fill out the following forms. Let us remember that nursing documentation is more than just writing notes. It is a reflection of the quality, safety, and accountability of the care we provide. Through accurate, timely, and complete documentation, we ensure continuity of care and uphold our professional and legal responsibilities as nurses.